am Dulip Pereira. I work for the National Hospital of Sri Lanka and I am the head of plastic surgery unit at the National Hospital of Colombo, which is a premier teaching hospital in the country. Yeah, I have worked at the National Hospital Plastic Surgical Unit from the beginning in my formative years as a very junior doctor before my qualification, and on the whole I have been in the field of plastic surgery for about 12 years, and as a consultant was a period of 8 years, and before that as senior registrar level many years. I was trained overseas for over 2 years at the Queen Victoria Hospital, East Queensland, and that is for 2 years, as I said, and then subsequently I was trained in Australia under Mr. Keith Mortimer, who is also a plastic surgeon, and then we attend regularly for conferences and operative demonstrations, paid operative demonstrations, and so on and so forth, to gain knowledge and experience.
I'm a plastic surgeon attached to National Hospital of Sri Lanka, and I work also at Apollo Hospital, Colombo. After completing my training in plastic surgery in Sri Lanka, just a little over 3 years, I went to Australia for my further training. I was attached to Royal Adelaide Hospital and Children's Hospital in Melbourne and Alfred Hospital. And I came back to Adelaide and worked at Queen Elizabeth Hospital for 1.5 years. So in total I was in Australia working as a fellow and a senior registrar for 3 years, and I had the opportunity to work with some of my consultants in private hospitals, and where I learned cosmetic procedures, especially in Melbourne with Chris Coombs and Keith Mortimer, and Adelaide with Richard Harris. I came back to Sri Lanka in 2001. Now I am working as a consultant plastic surgeon at National Hospital of Sri Lanka and Apollo Hospital, Colombo.
The popular procedure that most people ask for is liposuction. Then comes a lot of work on the breast in the form of breast reduction, mastopexy, augmentation, or mastopexy with augmentation, and of course abdominoplasties combined with liposuctions, and facial procedures like facelifts, rhinoplasties, implants on the face like maxillary augmentation, chin augmentation. Then I also do fat injections in selected areas of the face. So basically for cosmetic work, I move around in most of these areas. Yeah, I like the liposculpturing aspect of liposuction, and also I enjoy doing breast augmentations and mastopexies, of course reductions in very selected patients, not the large breast, but I like the medium breast to give it a nice shape and position and the aesthetic contours, and this constitutes my workload.
I do breast reductions, augmentations, mastopexy, and we do a fair amount of abdominoplasty and liposuction as well. So liposuction combined with abdominoplasty, or liposuction alone, thighs, hips, and the back, and liposuction of male breast or gynecomastia. And I do facial cosmetic surgery such as blepharoplasties, facial augmentation with implants, cheek implants, chin implants, and rhinoplasties, and pinning of prominent ears.
Yeah, basically I would infiltrate the area with tumescent solution. This is the basic combination of adrenaline, bicarbonate, and marcaine, and liposuction is done with the power-assisted micro-air liposuction device, which gives a very satisfactory result. And I have a range of cannulae to suit the requirement and the site. And it's a very good product, and liposuction is more than the regular pneumatic procedures. And results are very good, patients are very happy, and the ease of which the liposuction can be achieved, the volumes that can be sucked out are greatly enhanced with the new machine. And this can be combined with any procedure that I undertake, like the breast work, abdominal work, anything, the thigh lift or anything you call, we could combine the liposuction.
My preferred access or approach to breast implant is submammary approach, but depending on the patient, and sometimes I do axillary as well, but my preferred access approach is submammary incision, and depending on the patient, I select whether to use round or anatomical set implant, and most of the time I keep the implants in under the pectoral muscle, and before placing the implant and selection of the implant, I have a good conversation with the patient and what the patient need and what I think, and so after deciding, after discussing with the patient, then I decide the type of implant and my approach. And we use Nego implants. It's coming from UK.